Question number 5 is wrong statement about the branches of abdominal aorta. Celiac trunk arises opposite to the lower border of T12 vertebrae. Superior mesenteric artery arises opposite to L1 vertebrae. Inferior mesenteric artery arises opposite to L3 vertebrae. Gonadal arteries arises opposite to L3 vertebrae. So again, you have to find out the wrong statement here. Presume it the vertebrae T12, L1, L2, L3, L4, L5. You know that abdominal aorta descends from the aortic opening in the diaphragm and it descends down in the median plane like this. But down below it has slightly an oblique course. This slight oblique course makes it tilted slightly towards the left side 1.5 centimeter from the median plane. Just below to the diaphragm, ventral splachnopleuric branches. So from the junction of T12 and L1, there is this one unpaired branch that arises here and that is called celiac trunk. Then from L1 also there's an artery branch arising and L3 also arising. So keep learning with this. This is celiac trunk. Then you have is superior mesenteric artery and this is inferior mesenteric artery. Then there are branches arising which are ventrolateral splachnopleuric branches which is supplying the structures derived from the intermediate mesoderm, and as soon as it emerges out it gives a branch on the undersurface of the diaphragm, that is inferior phrenic artery, middle phrenic arteries at the same level as the celiac trunk, the renal arteries. Remember, these are very important. This is asked many times. Renal arteries arising at the level of the transpyloric plane, that is between L1 and L2. And then there are two branches which arise from the level of L2 vertebrae, and these are the gonadal branches. So I hope you understood the vertebral levels also. Why not include some other branches here? Remember that inferior phrenic artery gives this branch here. This is called superior suprarenal artery, and this renal artery also gives branch from here, and these are called the inferior suprarenal arteries. Remember that suprarenal gland is so much vascular, it has blood supply from 3 different sources, although it has a single vein. So keep noting down the vertebral levels. Gonadal arteries you can see as arising from the level of L2 vertebrae. Inferior mesenteric artery is arising at the level of L3 vertebrae. Superior mesenteric artery, you're seeing it is arising at the level of L1. Celiac trunk you can see is arising at the lower border of T12 vertebrae. And don't forget that the abdominal aorta terminates or divides into 2 terminal branches at the level of lower border of L4. Wrong statement of the branches of abdominal aorta. You have seen celiac trunk arises opposite to the lower border of T12 vertebrae. Superior mesenteric arises opposite to L1 vertebrae. Inferior mesenteric artery arises opposite to L3 vertebrae. Gonadal arteries arise opposite to L3 vertebrae. You can say that this is a wrong answer. Why? Because gonadal arteries arise opposite to L2 vertebrae.